There has been concern about breast surgeons and physicians in general providing genetic counseling. It turns out breast surgeons provide genetic counseling all the time. We surveyed the American Society of Breast Surgeons membership across the country. Breast surgeons are ordering genetic tests in over 50% of cases where those tests are ordered in those practices. And breast surgeons are providing the counseling over half the time. There's been concern that anyone besides a genetic counselor or a clinical geneticist might not be able to provide genetic counseling. The ASCO organization, the AMA, the American Society of Breast Surgeons all disagree with that notion that you have to have a genetic counselor provide that counseling. The NCCN guidelines specifically say that someone with experience and expertise, including a surgeon, should be able to provide that counseling. We really believe that genetic counselors are a tremendous resource to the healthcare team. Only in large academic centers and some large breast care centers are there enough genetic counselors to order every test that's needed. In fact, we know there's a huge deficit in testing right now. 220,000 patients in 2012 who were BRCA mutation carriers, 6% had been identified. So the genetic counselor population is a key resource, but to put those folks in the position of being gatekeepers for testing is a misallocation of that resource, and in fact is a barrier to appropriate testing. We really consider the fact that we have not identified so many carriers of important mutations sort of a medical education emergency. Physicians, breast surgeons, cardiologists, pediatricians all need to learn how these mutations impact the care of their patients. Genetic counselors can really help with that process, but not really so much as gatekeepers as overall support for the breast care team or the healthcare team. Traditionally speaking, there was this notion of one phenotype, one genotype, or very close correlation between phenotype and genotype, and those things do exist. On the other hand, what we have found is you miss a lot of things if you try to make that connection up front in every case. The fact that genetic tests are now so inexpensive can save the patient that sort of sequential, oh, it wasn't that gene, now let's test for another gene odyssey that they used to go through. And while there's been some controversy and there's some concerns about it, pretty much all genetic testing now is done as a panel unless you're looking for a specific mutation that's already been identified.